good morning, everybody. This is Brittany coming to you live from the Seniors Blue Book. And today I have the privilege to be speaking with Dr. John Dattilo of Coastal Orthopedics. Good morning.
Good morning, everybody.
How are you today?
Great. How are you doing?
Doing fantastic. I'm really excited to dive into the topic today, which is we're going to be talking about hips because, of course, that is your specialty. And first, let's talk a little bit about yourself, and tell us a little bit about your background.
Sure. So I'm originally from Cincinnati, Ohio, and I stayed around the Midwest doing my undergraduate degree at Northwestern University in Chicago, and then moved out to the East Coast for a decade and a half or so, and did medical school at Johns Hopkins University, and then my residency in orthopedic surgery at the University of Pennsylvania. And then I chose to do an extra subspecialty year just in complex hip and knee replacement training at the Anderson Orthopedic Research Institute, which is just outside DC in Alexandria, Virginia.
Awesome. I'm actually from Virginia. That's not far from where I grew up.
Oh, great.
Yeah, so thanks for sharing that. I know Coastal is so lucky to have you. And we want to kind of jump right into Medicare just recently announced that it's going to start allowing Medicare patients to have outpatient hip replacement, which is a big deal. Can you tell us a little bit about what outpatient joint hip replacement is, and what does this mean for Medicare patients?
Sure. So the short answer is that patients get to go home the same day of surgery. And the big focus is that you're recovering in your own home as opposed to recovering in the hospital or a rehab facility. And so that can seem a little scary, especially for people who may have had a hip replacement or a knee replacement that was done 30 years ago, because back then people used to stay in the hospital for a week sometimes. And what we've seen is over the last 10 or 15 years or so that a lot has changed. The anesthesia protocols have gotten better. The surgical techniques have gotten better so that we're having smaller incisions, less sort of trauma during the surgery. And this has really translated to a faster recovery, that people are up, they're moving around, they're having less pain. I think particularly in my domain on the hip side, anterior hip replacement has been a game changer for patients. And so what we started seeing is patients were just staying in the hospital less and less and less. And then eventually we started moving towards this decreased hospital length of stay and going home within first a day or then going home the same day of surgery. And I remind patients that you're having the surgery, but you're not sick, as opposed to a lot of the people that are in a hospital. You're recovering from surgery. And that has been really well received by patients, that we started doing outpatient knee replacements first in the Medicare population. It's gone very well. And we've actually been doing outpatient hip replacements for several years now, just with the commercial or private insurers. And so it's a very exciting opportunity to be able to offer that service and that opportunity for the Medicare patients now as well.
What are and you kind of touched on a few of these in the last question, but what are some of the benefits of having a joint replacement in the outpatient setting? Of course, you mentioned that shorter time, of course, the recovery time, but let's touch on some of those as well.
Sure. I think that the simplest answer to that is it's a little bit of a nicer patient experience, in the sense that a hospital is a good place if you need to be in a hospital, that they have a lot of resources. But what comes with that is the hustle and bustle of being in a hospital, that there are some inefficiencies in that system. There are delays. If there's an emergency, something that comes in and sort of disrupts or delays your surgery time, that when you do surgery in the outpatient setting in a surgery center, it's a little bit more of personalized care for you. And there's a little bit more of a sense of intimacy because it's smaller. Everyone works together and they're always sort of doing the same thing over and over. And so it becomes a really nice situation, I think, for the patient, just that patient experience and having their joint replaced in that setting. The other thing that we had touched on is that, for the appropriate patient, we don't do a lot for you in the hospital. That the nurse may bring you some pain medicine, or maybe you get to try out our nice hospital food or sleep in our nice hospital beds. And I say that jokingly because I think patients like it a lot more to be able to recover in their home environment, sleep in their own bed, eat their own food, and have their spouse or a friend, bring them the pain medicines and help them, get their food. And remember, this is elective or planned surgery, right? We're not talking about the person who fell off their bike or had some other kind of trauma and didn't necessarily get to plan their surgery. We have the opportunity to plan this ahead of time. And that is one of the centerpieces of my philosophy of surgery, is that the only thing I want patients focusing on afterwards is their recovery for their hip replacement. And so we do a number of things to prepare people for surgery to minimize any kind of anxiety or surprises around that. So the first thing that I emphasize with everybody who's thinking about having a hip replacement with me is that they have to identify a coach. And that's often a spouse, a significant other, friend, family member. But this is somebody who will come with them to their appointments, that will take notes for them so that when they're doing their therapy sessions, their coach is taking notes. Hey, just remember to do this next time, little things like that. And then that same person is the person that helps them around the house as they recover. The second thing is on the topic of physical therapy. Again, to decrease anxiety surprises, I like for people to meet with their physical therapist before surgery to plan that out so that they get to know their therapist, they get to learn their exercises, and then they know where to go after surgery. You know, they have all the things scheduled ahead of time. Again, one less thing for them to think about or worry about or anything like that. And then one of the last things is I personalize a pain protocol for everybody. So you can pick up your medicines ahead of time. You're not stopping on the way home from the hospital or the way home from the surgery center and worried about, oh, something didn't get filled ahead of time. And then you have a schedule on when to take your medicines, how to take your medicines, how to sort of start weaning off some of the pain medicines. And then lastly, I like for people to have a goal that they're working towards. And so I think having something that every time that they go meet with their therapist and it's sort of a light at the end of the tunnel or something they're working to get back is really a great motivating factor. And it's something that's very cool to talk to patients, you know, afterwards, and they're coming back to the office and say, all right, where are we at? You know, what do we need to do to get there? So I think all those things combined, you know, the outpatient ability to offer the surgeries outpatient has been a real game changer and really something that's been very well received by patients.
Absolutely. I mean, and I love that you call somebody a coach, that they identify that person as a coach, because it is a lot of times it's that caregiver. But I think that term is, when I think of a coach, it's somebody encouraging me and making sure that I'm doing the right things. And I love that you call that person a coach. You mentioned an appropriate patient. Tell us who would be a candidate to have for an outpatient joint replacement.
I think first and foremost, I mean, I mentioned a lot of the benefits. I think patients really like it, but at the end of the day, we need to make sure that what we're doing is medically safe. And so I get this question in clinic a lot of times where, you know, people say, I'm 70 years old. Can I do this as an outpatient? They want to, but they just are worried because of their age. And what I usually tell people is I care less about age and more about your medical problems. So I'd much rather let someone who's 70 but is otherwise fairly healthy do their hip replacement as an outpatient, go home the same day, than I would for somebody who is 50 and has had a couple of heart attacks or something like that. So that's an individual discussion that I have with every patient, and we balance what are those risks. And there are some little risk calculators that we can use in clinic as well to help us direct that. But it's a very personal discussion I have with everybody. The second is going back to that coach. I think that it is absolutely, you need to have somebody at home that is going to be there. It's going to be your coach, your social support, your, you know, help around the house kind of thing for the first several weeks after the surgery. So that's the sort of number two thing that you have to sort of balance. And then the third thing is that they have to want to do it. I'm not here to push anybody into doing it as an outpatient. In fact, usually it's the opposite. Patients really have seen a friend or a family member that did as an outpatient, had a great experience, and they're sort of pushing me to let them do it as an outpatient as well. There are some people who don't want to do it because they like the idea of having a safety net, so to speak, in the hospital, where they feel like, oh, if something happens, then I'm in the hospital. I think it's interesting how that has shifted, even over the last 5 to 10 years. And in fact, there's a great article published by some of the guys up in Indiana that looked at patient perceptions for outpatient joint replacement. And it's really has been a patient-driven success story in the sense that they feel very strongly that going home and recovering in their own home is better for them. And there's less infection and there's more of a sense of normalcy. And And I have to say, I agree with that perception. I've got a number of patients who maybe had one hip done in the hospital and one hip done in the surgery center. And I'll tell you, almost universally, people come back and say, I really, I do it in the surgery center again in a heartbeat. So like I said, it's been a very, very cool patient-driven success story, I think.
So Dr. Dattilo, you've mentioned the word or phrase game changer, and I think it's important to bring that back up and maybe mention what has been the biggest game changer in your practice for joint replacement.
I think the biggest game changer has been our pain protocols. Historically, opioids or narcotic medicines were really sort of the mainstay of pain control after surgery, but these have a lot of side effects. They can be very addicting. And so in the last decade, we have started to incorporate what are called multimodal protocols, which means that you use a number of other non-narcotic medicines first and kind of reserve the opioids for breakthrough pain. So the current generation of protocols are what we call opioid sparing. So they still do involve some opioids. But we've also partnered with our anesthesiologists to use different nerve blocks, to use different medications during surgery as well, that I think have really changed, like I mentioned, how we do the operation compared to even 10 years ago. And I think that one of the great things about doing this in our surgery center here at Coastal is that I have essentially the same 3 anesthesiologists that I work with. So we have better communication, I think. They know my protocols. There's less variation or possibility of working with somebody who you might be unfamiliar with in a hospital setting. And it also enables us to quickly incorporate some of the most cutting edge techniques because of that really close-knit relationship. So it's a really great experience for me in terms of the collegiality. And in fact, I mentioned our protocols are technically opioid sparing because we do use some narcotics, but I'm working with our anesthesiologist to start what we're going to call an opioid free joint replacement pathway for some patients who may be interested in trying that.
That's amazing. Thank you so much for sharing that, because I do think that's such a vital concern, or, in the post-op care, people are highly concerned with the level of pain they'll have and how it'll be managed. So it sounds like a fantastic plan that you prepare them with individually. Are there any last things that you'd want to tell patients who are considering hip replacement surgery?
Yeah, I would emphasize quality of life in the sense that I tell patients, once you stop doing the things you like to do because of your hip pain, then I'd invite you to come in, see me or one of my other joint replacement partners, get some x-rays and see what their options are, be it medications, injections, or whether they're a candidate for surgery. And if they do decide on surgery, a hip replacement is a very successful operation. In fact, one study published in the Lancet Medical Journal looked at all the operations of last century, and they called the hip replacement the operation of the century, literally because of how successful it was in improving people's pain and really allowing them to keep doing the things that they love doing. And so I can tell you without a doubt, in my practice, having patients come back to the office and essentially say they have a new lease on life and that they can go golfing again or do whatever activity it is that, again, I make them kind of pick out that goal that they get to do again. They love that. And that's consistently the most rewarding part of my practice.
I love it. Well, thank you so much for your time today that you spent with us. This is a brand new actual titled segment now called Doc Talks with Seniors Blue Book, and we've been working with Coastal Orthopedics, and you guys are a wealth of information, so I always love jumping on with the different physicians there. And again, this is Dr. John Dattilo with Coastal Orthopedics, and if you have any questions or want to reach out to Coastal to schedule a consultation, please follow the information in the post to do that. And thank you again, Dr. Dattilo, for your time. I appreciate all the information that you've shared today.
Thank you very much. Have a great morning.